And now to our exclusive interview with Health and Human Services Secretary, Robert F. Kennedy Jr. Kennedy turned heads as President Trump's pick to lead HHS. For decades, he has been a vaccine skeptic and promoted the bogus claim that they cause autism. Now Kennedy is overseeing billions of dollars in controversial cuts to his department and leading the response to a multi-state measles outbreak. Hardest hit, as we know, is Texas. As of yesterday, it's reported 505 cases since January, including the deaths of 2 unvaccinated children ages 6 and 8 years old. Dr. Jon LaPook sat down with Kennedy. This is his first network TV interview since becoming HHS secretary.
It's one thing to say the measles vaccine is the best way of preventing spread, but it's another thing to then say, and therefore, we suggest that you get the measles vaccine.
We encourage people to get the measles vaccine.
Okay, so that, I think that's actually the next step, and that's news as far as I'm concerned, that you're saying that. What's the position philosophically of the federal government in terms of public health?
The federal government's position, my position is people should get the measles vaccine, but the government should not be mandating.
Understand.
Those. But I've always said during my campaign and every public statement I've made, I'm not going to take people's vaccines away from them. Right. What I'm going to do is make sure that we have good science so that people can make an informed choice. And we are doing that science today so that we know the risks of that product, and we also know what the benefits are. And right now, we don't know the risks of many of these products because they're not safety tested.
And I understand that position, but just to be clear, you are saying, and we do on the federal level, and you personally do recommend that people get the measles vaccine.
And when I say they're not safety tested, what I mean is they're not adequately. Many of the vaccines are tested for only 3 or 4 days with no placebo group.
Before yesterday, HHS Secretary Robert F. Kennedy Jr. had said the measles vaccine is the most effective way to prevent the virus from spreading, but stopped short of actually recommending it. It's a stark about-face for the long-time vaccine skeptic.
All these different grains are grown locally on Indian land.
We met the secretary in Mesa, Arizona, where he visited a native health center as part of a 3-state tour to promote the administration's Make America Healthy Again agenda, which includes overhauling standards for processed food.
FDA needs to start regulating food again and saying, not just when food is adulterated, when there's bacteria in it. Let's look at the chemicals in it. I, Robert F. Kennedy Jr.
Since his appointment in February, Kennedy has facilitated sweeping cuts for programs and staffers alike.
You proposed more than $11 billion in cuts to local and state programs addressing things like infectious disease, mental health, addiction, and childhood vaccination. Did you personally approve those cuts?
I'm not familiar with those cuts. We'd have to go.
There's like more than 50 pages of cuts that I actually went through.
The cuts were mainly DEI cuts, which the president
There were a lot, but I'll give you, for example, about $750,000 of a University of Michigan grant into adolescent diabetes was cut. Did you know that?
I didn't know that, and that's something that we'll look at.
Yeah, so that's, I wonder, should these be considered Doge cuts?
Well, I couldn't speak to that, Dr. LaPook, because I'm not familiar with that particular study. But there's a number of studies that were cut, that came to our attention, and that did not deserve to be cut, and we reinstated them. Our purpose is not to reduce any level of scientific research that's important.
But with billions of dollars in cuts at stake, a fundamental question remains.
What's the basic level of care every American should receive, and who should pay for it?
When it comes to health care, that's a difficult question because people have a choice about how sick they're going to be, many people. If you don't have any choice, then, then we should give you all the resources that you want. But it's a moral question too, and it's a philosophical question. If you're smoking 3 packs of cigarettes a day, should you expect society to pay when you get sick?
Maybe pay for you to help stop smoking.
Or should we encourage people? Should we incentivize people to take care of themselves? And then when they get sick, make sure they're taken care of.
And Jon LaPook joins us once again. Jon, there was a couple of instances in the interview that we were all like, what did he say? You know, for instance, he didn't seem to be quite sure what all the cuts were that were being made at his own department. What did you make of that?
Yeah, that was remarkable to me, too. And you wonder, you know, it seems like these are DOGE cuts. And that brings up the question, what are the specific criteria being used for waste, fraud, and abuse? And specifically, that example of the University of Michigan, there was $750,000 cut in a grant to study adolescent diabetes. And you have to say, like, who's making that cut? That decision, people at DOGE, what's their scientific background? Do they have the expertise to be able to actually look at that study and say, okay, I understand what's going on? So that's a big question to me.
Yeah, listen, he very rarely does sit down interviews, and this was his first since taking the job. What was your, so kudos to you, by the way, for getting it, but what was your biggest takeaway from what he had to say?
Well, I think the big news here is, you know, he came out and recommended that people take the measles vaccine. And I think that's a big deal, especially during an outbreak. I do have a lot of questions about the cuts, specifics about them, specifics about the programs to come. Of course, it resonates with me, the goal of decreasing obesity, chronic disease, diabetes, but the devil's going to be in the details. But I do want to say I was impressed with the tone of the conversation, which was civil and respectful. They gave me a lot of time, a lot of back and forth. And so I look forward to that in the future, to sort of try to get my arms around and our arms around what exactly is going on. What are the details here?
There's so much at stake. I hope the doors do remain open with communication. And you're right, he sat and answered all the questions that you had to the best of his ability. Thank you very much, Dr. Jon LaPook. Thank you.